evening, everyone. I am Dr. Sabyasachi Roy, consultant physician practicing in and around the region of Dandam. I'll be speaking something regarding the hypertension in regards to the World Hypertension Day, which was on 17th May. So, what is hypertension? What is understanding hypertension? Our today's discussion will be on what high blood pressure is all about and how to prevent it. Generally, everyone would like to have a healthy and a normal blood pressure, but we exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood lumen, and this creates pressure against the blood walls of the vessel. This is called blood pressure. Normally, in healthy person, it rises and falls throughout the day. But when the blood pressure remains high for a longer period of time if it is left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. Now, what is high blood pressure? High blood pressure is usually develops over time. It can happen because of unhealthy lifestyle, for example, not having enough regular physical activity, obesity, smoking, alcohol consumption, stress, etc. There are many risk factors that can also increase the risk of developing hypertension, such as aging. Maybe these are the non-modifiable risk factors. Aging. As the people get older, the arteries get stiffen up and the narrow and excess fat build up. The family history. Excess salt intake, not eating enough foods with potassium can result in increased blood pressure. Eating processed food and fatty foods. Another one is reacting to stress in unhealthy ways and not managing the stress is also leads to increase in the blood pressure. Moving on. Hypertension does not have any obvious signs and symptoms, but that is why it is called a silent killer. It puts the people at risk for several diseases from cardiovascular problems to kidney failure, stroke, and even eye damage and blindness. Hence, early and accurate diagnosis is very important in the management of hypertension. Measuring the blood pressure at regular intervals will help to assess the person to have whether he is having high blood pressure or not. Generally, when the symptoms do occur, they include morning headache and tiredness, vision changes, blood buzzing in the ears, fatigue, nausea, and vomiting. In experiencing some of the symptoms can then one should go to blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It is measured by instrument called a sphygmomanometer. The blood pressure is recorded in two numbers, so the systolic and the diastolic. Now, let's try to understand what the numbers actually mean. A healthy and a normal blood pressure should be lower than 120 by 80 millimeter of mercury, or it can also be read as 1 in 120 over 80. Here, the number indicates a systolic blood pressure, which means pressure in the blood vessels and the heart contracts, whereas the lower number indicates the diastolic blood pressure, means the pressure in which the blood vessels when the heart rests between beats. If the blood pressure level is more than 140/90 millimeter of mercury, then the person have hypertension. If person have BP control levels higher than this, he or she might have developed serious cardiac diseases. On May 17th, we celebrate the World Hypertension Day. Our day is dedicated to highlighting the importance of monitoring blood pressure and bringing the global awareness to 1 million people living with high blood pressure worldwide. The theme of this year is World Hypertension Day is measure your blood pressure, control it, live longer. Ensure the BP is measured at regular interval and is controlled if it is elevated. The risk can be prevented and reduced by taking steps towards a healthier lifestyle, such as regular exercise, healthy diet, quit smoking and alcohol, regular blood pressure monitoring, stress management, adherence to medicine. If the blood pressure is successfully controlled with such lifestyle mitigation, then it might avoid, delay, or reduce in the need for medication. So let's take a look at the strategies one by one. One is the regular exercise, physical activity. Exercise can be a drug-free approach by which we can lower down the blood pressure. The physical activity makes a person's heart stronger and healthier. A healthy diet. A diet also plays an important role in controlling the blood pressure. Eating the vegetables, fruits, and whole grains recommended in hypertensive patients and lowering the blood pressure. A DASH diet or a Mediterranean diet. Eating less saturated fat and total fat, getting plenty of potassium, limiting the amount of sodium in the fat in the diet, and alcohol consumption is to be avoided. Now, reducing the sodium in your diet plays an important role. Even a small reduction in the sodium in diet can improve the heart health and reduce the blood pressure to about 5 to 6 millimeter of mercury if you have a high blood pressure. Now, regarding the DASH diet, the DASH stands for the delivery approaches to stop hypertension. Dietary approach to stop hypertension. Eating a DASH diet, that means which is rich in whole grains, fruits, vegetables, low fat diet, and skims or saturated fat and cholesterol can lower one's blood pressure up to 11 millimeter of mercury. The third point is quitting the smoking. One who smoked must quit the smoking to reduce the risk factor of heart disease and improve your overall health. Now, quitting regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure by visiting the doctors, but it is not always possible for patients to visit doctor and check up their blood pressure. Hence, most of the patient is often advised for a self-monitoring of the blood pressure levels. Self-monitoring can be measured throughout the day and over a longer period of time. It also assists the doctor to get a complete picture of the blood pressure readings at different intervals of the day and the prediction of the cardiovascular morbidity or mortality rather than a single routine blood pressure measurement that occurs during a clinical visit. Now, coming to the stress management, which comes to the fifth point, by learning how to relax and manage the stress can improve the emotional and physical health and lower the high blood pressure. The stress management includes the exercise, listening to music, focusing to something calm and peaceful, and meditating. Now, the adherence to medication. This is very much important. To medicine to lower down the blood pressure may be recommended by doctor if your blood pressure is consistently high, usually above 140/90. Adherence to the medicines is very much important to control the blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having a healthy life. Keeping the blood pressure in the normal range is very important in preventing cardiovascular complication. It is very much possible to maintain the normal blood pressure levels with regular monitoring and preventive care. Thank you.